So for me, I think the major problem really for me, as far as healthcare in Africa is concerned, is one of, obviously we need to look at the demand side as well as the supply side.
Okay.
So the demand side, how interested are Africans in actually, seeking for the right healthcare? And the supply side, governments and other non-state actors, how readily are they to provide the kind of healthcare that our people, require? And so for me, if we need to really look at healthcare in Africa, we need to also look at issues of universal health coverage. How easy is it for somebody in my village, for example, in Anambra State, in one of the remote villages there, to be able to access healthcare without, suffering any kind of financial hardship or not even affording it at all, simply because of inability to pay or distance or unavailability of healthcare workers. And we cannot forget or, rather remove the threat of infectious disease outbreaks. This is something, lots of people are not really aware of, especially if you don't work in the health space. As we speak now, there is a particular report that comes out of WHO Afro called, weekly reports on epidemics and outbreaks. Africa, sub-Saharan Africa is dealing with at least about 157 infectious disease outbreaks as we speak. These things have to take their tolls on, on our health, on the economy, on all sorts. I've been looking at COVID-19, we see the kind of impact that infectious diseases can have. Of course, monkeypox is also trending now. So that thin line between our people realizing that health is important and thereby, demanding for healthcare, and also, government and other players also realizing that health is important and making that a core part of, the political agenda.